The best place to be is at the corner of a table, because what you're going to need as a therapist is access to kind of both sides of the person as you test the different movements. Okay? If you're sitting in the center of the table, I can't get beside them so well. So corner's the best. I need the height of the table appropriate for me to perform the maneuver, but I also don't want their feet necessarily dangling either, because if they're dangling, then he's going to want to have to hold himself a little bit more upright in some of his muscles, which I'm trying to make this a passive motion, okay? So if I'm thinking about the neck, we might even be able to get rid of that because you're too high for me. Kyle's tall enough where if his feet are on the ground, then I don't need the step stool. But if you're working with someone with a shorter stature, you might need that step stool there for you. Okay. So we already established, if I take his head and I say, okay, just kind of relax, and I pull forward, what's his muscles immediately going to do? They're going to catch, right? Because his head's falling to the earth, they're going to catch, and that's not so much a passive movement. We talked at great length with the elbow and especially the shoulder, how it's important to actually support the person's arm. You got to have control of it. I have to have control and support of his neck and his head. And unless he feels like I have that, he's not going to give me a good passive movement. He's still too tall. Okay. So how do we get around that? I am going to actually come into him, and my elbow, basically just about the crease of my elbow, is going to come right in on his forehead.
So that's how you know how much to adjust the height of the table?
Yeah,
okay.
Pretty much where I'm going to be standing in relation here. Okay. Now this is still a problem if my goal here is to just simply pull him forward. Again, as much as I have control here, if I just pull him forward, his head is outside of his base of support, and immediately his muscles are going to check in, okay, are going to kick in. So what I want to do actually, Kyle, sit on up straight and tall for me, okay, is we are going to start rocking. We're going to do a rocking movement. When I look at passive range of motion extension, I am going to pull him forward and extend him at the same time. That's generally not so, that's not a happy one. This is, we talked about what's stretching, what's pinching, and you guys got really good with the muscles. What you pinch like crazy back in here are all the facet joints. So every joint that makes up his neck is going to be compressed and pinched on each other. And if you have any type of a pain or dysfunction, you guys can look up right now. If you just look up really hard and it feels like a little tight and strained or painful, imagine what that feels like with the extra overpressure. That can help lead you into thinking if there's a facet problem on that side, especially if they complain of that pinch and pain on that side, okay? The purpose of the weight shift is all about keeping his head over his base of support, which is his hips. This is where all his weight is. So if I move him forward, I can bring his head back, and his head is over his hips. For flexion, we're going to do the opposite. I'm going to let him go backwards, but his head is over his hips. Okay, so I won't do extension again, but on 3, we're just going to go forward. 1, 2, 3, and then I can bring him down and get a good passive range of motion for flexion. Okay, that's extension, flexion. Side bending. I can try to climb up and over him, but that would be very difficult, right? So what I'm going to do is it's going to be a combination of me tilting his head sideways, but also pulling him towards me at the same time. Once again, keeping his head right over his hips where they belong, okay? So same hand placement. I want his head mostly neutral at first. What I do now, what you'll see different, is my feet, when I'm doing flexion extension, I'm going side to side. My feet are side to side with me. Now that I know I'm going to be going a different direction, I change my foot position, forward, backwards, because now I'm going to be doing this way. Also, it gets my gut out of the way of his shoulder, so he's got some room to come into. So, sit nice and tall. Hey, supposed to be a PT student. So, passive range of motion, I'm just going to pull him into me while going over sideways. Okay. For rotation, I'm just going to take the back of his shoulder, and I'm going to bring his shoulder and his head around together.
And we're supposed to be holding these for 5 seconds? Like we
Yeah,
did
if you can hold it for a few seconds, definitely at the end.
Okay.
Okay? You can do extension, flexion, side bending, and rotation in the exact same spot.
What's your position for rotation?
Actually, I kind of went back to my side to side.
Okay.
because I'm kind of more that way. Okay. To get this side bending and this rotation, this is where I need to change my position and come around to the other side. Okay. Now what I'll do is for side bend in, I'm going to have him come towards me, right, and then rotation, left, left and left. I said right, left and left.
For rotation, do you need to, because wouldn't his head be staying over?
It would be staying over. The reason why is in order for me, if I'm here to do full and not move that shoulder, I got to do this. I got to come all the way around like this because he's going to get around. If he's got normal range of motion, he's going to get that far. So what I'm trying to do is I'm trying to do both at the same time. So really at the end, I'm not having to, I don't have to go all the way around there. So I'm rotating from below and above at the same time. Okay? Kind of taking up both from both ends.
If the patient is guarding,
Uh-huh.
we can gauge how far, but when you have your hand over them, how are you supposed to gauge?
Well, I mean, you can do it gently
You
and
can
see.
feel the muscle catch, or-
You could feel the muscle catch. Generally speaking, the anterior muscles aren't going to really contract and spasm on you so much. They might a little bit when you're going this way. But again, all this is as soon as the person has your pain, you can stop where you are. Okay?
So the main purpose of this is to elicit symptoms. It's not because your visibility.
Mhm.
I mean, now we can't see. We can't
Well,
really see.
you're right. Can I see how far I'm going? Well, I can kind of get a guesstimate a little bit from here. But remember, I've already seen what they can do actively.
So
Mhm.
that's where we get.
Yeah, so passively, I should get at least that, if not more. I'm looking for reproduction of the pain symptoms, as well as any complaints. If I do feel any type of tensioning or spasming of the neck muscles that come on, not as often. Resisted range of motion is done in neutral. You're just doing the passive range of motion testing, but now you're asking the person to not let me move you. So for extension, if I wanted to test his extensors, I'm going to flex him, but I'm going to tell him, hold, don't let me move you. So now what we're going to do is I'm going to try to move you the same way directions we just did, but hold, don't let me move you. Okay, so first I'm going to try to push you this way, hold, don't let me move you. And I'm trying to do the passive range of motion, but he's holding me. I'm going to try to lift your head up, hold, don't let me move you, and they're already kicking in, and I just slowly lift that up. I'm going to try to push you sideways this way, hold, don't let me move you. Good. And I'm just going to try to turn your head again. Hold, don't let me move you. Good. I'm going to come to the other side because I've got side bend and rotation to do again. I'm going to try to push you sideways one more time. Hold, don't let me move you. Good. And the last time we're just going to turn this way. Hold, don't let me move you. Okay?
So when you do side bend, are you pushing with your torso against the side of the
Yes, it's more like my shoulder here. We're going to do this. For passive range of motion, I'm pulling his shoulder and with my, I'm not really going over the top of him. Like I don't want to be and fall over him. So I'm kind of more pulling his shoulders into me, and that just makes the movement happen. Same thing for resisted. I'm just trying to pull in and with my shoulder here, just kind of bracing, hold, don't let me move you. And he just kind of pushes into that. Some things you really want to be wary of when you're doing extension. You don't want to see the neck rotating at the same time. So when we're not really looking, how'd that feel? That position and position there,
So we do it.
really gonna compress the right side, but not give me so much information about his left side, right? So that's why we want to make sure we're being clean, forwards, backwards, and side bend. And we want to try to do pure side bend and not let it rotate and come out of position. Okay, try to keep them in the cardinal planes. So when you're working on each other, having another person kind of stepping back watching, are you keeping the head really straight the whole time? Okay?
And the posture too, like I think to adjust it the whole time, so I'm to sit up.
Yeah, well what he does is he slouches all the way, and once he's slouched, there's no movement here anymore, right? Because he's taken up all of his motion. So now I need him, I'm trying to push this forward, but he doesn't have that much. So like, if you can kind of sit up nice and tall for me, that makes it a lot easier for me here in the neck. He loves having his neck extended. All right,